At Sydney Endometriosis, we're great advocates of ultrasound, and we really believe in the power of ultrasound. And so part of the overall way in which we manage our patients is bringing ultrasound into the management and making it front and center, because that's a really important way to potentially avoid surgery in those patients that either don't want to or their symptoms don't necessarily warrant surgery. And so it's a great way to get a diagnosis without performing an invasive procedure. Also, performing an ultrasound can be a really good way to get an understanding of whether someone has low volume or high volume of disease, or low stage or high stage disease. And one of the other really important benefits of ultrasound is that it helps me to know ahead of time if the endometriosis affects someone's bladder or affects someone's gut, because under those circumstances, if we think about performing surgery, then we're going to need to have individuals such as urologists in the case of there being bladder endometriosis, or surgeons such as colorectal surgeons at the surgical table when there's the presence of endometriosis on the rectum itself. So I think that ultrasound's a game changer when it comes to the diagnosis of endometriosis, when it comes to understanding the stage of disease, and also planning surgery so that we can ensure that we've got the right surgical team at the surgical table at the first operation to get the best possible outcome.